Hello, I'm Kendall.
And I'm Lindsey.
Today we're going to be doing the lateral and posterior palpations of the hip and pelvis.
This includes the greater trochanter,
The trochanteric bursa,
the medial sacral crest,
the gluteus maximus,
the ischial tuberosity and bursa,
the hamstring muscle group,
the piriformis,
the sacroiliac joint,
and the median sacral crest. So we're going to start with the greater trochanter. You're going to have your patient supine and their affected knee, put at a 45-degree angle. In reality, you would be on the affected side, but for the purpose of this video, I am on the opposite side. So you're going to go in through your ischial tuberosity, and you're basically feeling all the way up. And you should feel a bony prominence. If you feel like you can't find it, I'm going to come around this way. If you feel like you can't find it, you can have your patient internally and externally rotate. There you go. So you should feel a bony knob and you should feel the roll of the femoral head. Then if you come literally directly above it, you'll find your trochanteric bursa. But due to it not being inflamed, it's going to be very difficult to palpate. But that's where it would be. You would feel the bursa if it was inflamed. Next is the gluteus maximus. Where the gluteus maximus is, it starts about mid-sacrum and coccyx, and then travels up through this iliac crest and kind of comes all the way around and attaches, and ends at your gluteal tuberosity and part of your mid-femur. So in order to do that, you're going to basically, the way the fibers run is they run in a diagonal pattern across the body. So you're going to go in and basically work inward. So start at the edges that you have and basically work in. So next we're going to do the ischial tuberosity and bursa. You're going to have your patient supine with her leg bent at a 45-degree angle, or in this case, Kendall has both. You're going to start from, I recommend going from the medial hamstring and working your way down because I feel like it's going to make your patient a little more comfortable. And you're going to travel down the midline of the buttock, and you're just going to keep going until you feel a bony prominence on the back of their knee. Oh, right there. Kendall's is right there. The bursa is going to sit directly on top of that ischial tuberosity. However, it's going to be very difficult to feel it unless it's inflamed because it does reduce the friction in there. So you would just move up a little bit above that bony prominence and you'll feel it.
So now we're going to palpate the hamstrings. We're going to palpate them as a group. So they're going to originate at the ischial tuberosity, and it's going to go down into the medial epicondyle of the tibia and the fibular head. So you're going to start up into ischial tuberosity and palpate down. The medial side is going to be your semimembranosus. The middle aspect is going to be your semitendinosus. And your most lateral aspect is going to be your biceps femoris. Okay, so now we are going to palpate the piriformis. You're going to have your patient lying prone, and you are going to first locate your coccyx. So once you find the edge of your coccyx, you're going to locate your PSIS of the same side, which is right there. So you have your coccyx and your PSIS, and then you're going to locate your greater trochanter. I'm going to actually have her internally rotate and externally rotate. That way I can find the head of her trochanter. Good. Okay, and relax. So you have your greater trochanter, your coccyx, and then your PSIS. Your piriformis is going to be located along the edges of the T that you made here. So this is going to be your piriformis.